and CIO. And Erica is going to be doing the actual live walkthrough demonstration of the solution today as we go through. And I myself will guide us through this very short introduction as we want to maximize the time that we'll be able to spend showing you the NCCM application. So again, today's agenda will be pretty short and sweet with the bulk of the time spent on the actual demonstration, but we did want to spend a couple of minutes just talking about Salesforce.org and Provisio Partners before we get into the demonstration, and we will reserve some time at the end of the presentation for an open Q&A. In the chat feature also with this, you'll be able to type any questions you have as you see Erica kind of navigating through the solutions, but please feel free to chime into the chat and ask your questions as we go through. So as we begin, we are going to specifically talk about Salesforce solutions today, specifically as it pertains to the nonprofit cloud by Salesforce, particularly program and case management. But we would be remiss if we did not mention that Salesforce is the only true, what we call a platform as a service solution. So in addition to the program and case management, the offer around fundraising, whether it's donors and fundraising, whether it's marketing outreach and engagement through Perdot, the Experience Cloud Web Portal, the grants management functionality, volunteers functionality, tying your backend financial systems into your Salesforce instance as well. It is the only true, as I said, platform solution for human services that is offered on the market today. The other part of it is it's very secure at the end of the day. 97 out of the Fortune 100 use Salesforce to manage their data. So it's also a very secure solution and the most secure solution in the market today. So a little bit about Salesforce and now a little bit about Provisio Partners. We are one of the exclusive implementation partners for Salesforce, and we focus specifically and exclusively on human services organizations and nonprofits, which means we don't do any .com organizations or for-profit organizations. We've also extended and now offer solutions to the public sector, and we offer solutions all across the United States as well. And the solutions that we develop, I like to mention this as you look at the staff makeup at Provisio Partners, at least 50% of the staff that work at Provisio Partners comes from the same side of the desk as many folks on this call, from a nonprofit or the human services sector. So we like to say a lot of the solutions that we create and develop for nonprofits are by those same professionals who have walked a mile in your shoes. So that leads us back to our mission statement to basically serve and empower change makers, the folks on this call, with right fit Salesforce solutions so they can make the best decisions for their clients and their mission. So as you see here, here's a brief sampling of the clients and agencies and organizations that we work with. So for some local folks in certain cities, you may recognize a lot of these logos. For some more national folks, you may recognize like Goodwill Industries and Catholic Charities. The important things that we do like to mention on this particular slide is it doesn't matter where in human services on that spectrum, that cause area that you fall, we have deep experience within those areas. So whether it's health supports, employment and job training, housing and shelter, again, basically any cause area that it pertains to nonprofits and human services, we do have that experience working with those particular clients. So again, we're going to touch on specifically for this demonstration today, the Nonprofit Cloud Case Management, or NCCM, by Salesforce. There's going to be a lot of things that Erica is going to show you today. Some of the most recent additions to the functionality suite have been around intake and referral, but I'm not going to steal Erica's thunder and let her cover that with you during the presentation. But again, some of the areas that we're able to put on the slide, we can't fit everything, but we certainly will be able to follow up with you towards the end and after this demonstration. But again, we have deep experience in housing, shelter, and homelessness, workforce development, early child care, aka Head Start and Early Head Start, and a lot around aging and reentry as well. So that said, I am going to turn the presentation over again to Erica Cox, our CIO, so she can actually show you what we've been talking about and what you came here for today. Erica?
Thank you, Thomas. Turns out I can't get off mute while I'm in the process of sharing my screen. So that took a second.
No worries.
Apologies for that. So thank you all for joining us today. Excited to show you NCCM and that product. Um, so we're here today. I am logged into Salesforce as a case manager. So you'll see that I am in the case management app, and the first thing that I'm going to see is my homepage. So this is what's going to keep me on track every day. It's going to have a nice welcome message for me, tell me what date it is in case, I forgot my watch this morning or don't have my phone. And it's going to have a couple key things. I'm able to create a new contact or client right from here. I could jump right to my notes. I could view my program engagements, which would really be my caseload. I also have the ability, I can see what events I have today, and we're going to talk about this in a moment. And there's a dashboard that comes delivered with NCCM that's going to tell us which of my contacts on my caseload may require follow-up. So has someone been absent? Are there people who I haven't had outreach with lately that I need to make sure? So it's really trying to really allow your case managers to focus on the people and allow the system to focus on what they need to do next. So you'll notice I've got an open task here that's overdue. With Carol Brady, I have a couple tasks due today that we're going to take a look at, and it's showing me what I have to do tomorrow. So it's really helping me get that brief overview. Probably, your case managers will have far more tasks than this. I want to point out this is a demo environment, so the amount of data and the numbers may seem a little bit skewed because of the data that's here. We're also able to see incidents that have happened. So NCCM allows you to track incidents, whether they be on location or in your facility as they are now, or things that may have happened with other things that may have happened with your client. So we're going to take a look, and I'm noticing that the very first that I have an appointment later for an intake follow-up that's coming up shortly. So I want to make sure it's 12:07 here. So I've only got 23 minutes to prepare myself. So I'm going to take a quick look at this task. And I see that I am doing an intake with Maria Diaz. Now, I remember having spoken to Maria last week when we started her intake, but I want to familiarize myself with her. I've talked to a lot of clients since then. So when I hover over this, I see kind of that snapshot of her. It's going to tell me, what household she's a part of, what her birth date was. For instance, I'm getting that, but I'm going to click into Maria's record and get a little more information just so that I'm prepped for that meeting. So the first thing I'll notice is that I've got Maria's picture here and a client card that, again, is an expansion of that hover detail that we saw a moment ago. I can see her age. I can see any critical alerts for Maria. So if she were to have an allergy, for instance, or were a domestic violence survivor, I would see that right here. So anyone who looks at her record would know those things that are very crucial. I'm also, of course, able to see all of the demographic information about Maria that is so important for all of your reporting needs, as well as her contact info, her address powered by Google Maps, her emergency contact, everything we might need. Obviously, this is an area of much customization because your needs will probably vary and your funders all vary. I can see also at a glance all the programs in which Maria is engaged. This is a huge benefit of NCCM because we can see not only where she's been engaged, but what the extent of her engagement has been. So how many goals, and these are all items that we'll talk about in a moment, but how engaged has she been? So we're just able to get a snapshot, and we'd work closely with you during implementation to ensure that case managers are only able to see that information that's necessary for them to serve that client. But this is a pretty wide open environment because it's a demonstration environment. So we want to make sure we can see everything. But I do want to rest assured that, people will only see that information that we've decided they have access to. So I'm kind of getting an overview of Maria, but I seem to remember that her family has some involvement with us as well. So I'm going to look at her family or household record. And this is actually, this household account model is part of the nonprofit cloud, of nonprofit success pack. But we use it very often. It's not a requirement to do this because some of you will have program models where you truly are serving an individual. But in my particular organization, it's really important for us to view the family as a whole. So I'm going to see here that Maria has, several children and her husband, Frankie. we're able to see all of the program engagements, all the ways in which her family members are connected to my organization too. So I can see that her son Carlos and daughter Daniela are involved in our after school programs, and Maria's been involved in a rapid rehousing program, and she is now coming to us for employment services. So if I wanted to know how Maria had done, again, getting that whole picture of Maria before I speak to her. We know that sometimes our clients have difficult stories to tell. We don't want them to have to retell them. So I'm just going to familiarize myself, and I can see that the reason she left rapid rehousing is that she successfully completed it and the family was able to move to market rate housing. So that's important things for me to know as I counsel her on her employment journey. We want to make sure they don't lose that market rate housing because of, changes to her employment situation. So going back to Maria, we're going to look at the rest of the information that we've collected on her. We have a case plan from before. We're going to talk about that in a moment. I want to talk briefly about some assessments. So I could see here that, NCCM allows you to capture assessment information, and then it shows it on a graph. So you can see from an individual's perspective how they have been progressing. This is another area of significant customization during the implementation process, because we can certainly capture just the assessment score, but there is often numerous assessments that you may need to create during the course of this. So in this example, we have, for instance, a self-sufficiency matrix where we are showing how someone's doing in all of these various domains. And then we can see how that goes to, what those meanings are of those domains. We can get in our help text. And at the end of this, once we did it, we would get a score. I'm not going to show that today just because our time together is short. So we can see all of her assessments. And then, of course, we've got additional information like the intake that we're going to have to start on today. Any cases that she has, these are the referrals that Thomas mentioned. So we can see, sorry, my hovering is going crazy. We can see that she had a referral for home visiting. That's for her infant daughter. We haven't acted upon that yet. We've had an inbound referral for an existing client, and we've done an outbound referral because we referred her to the local food pantry. I did that during the start of the intake the other day. So I'm reviewing all of this. You can see that this is where I would add a client alert. And then we've got client notes and service deliveries that we'll get to in a moment. We also have the full ability of Salesforce to track events, like we looked at the one that we have scheduled for today. We can see that also from Maria's record. So it's not in isolation on my calendar. It's connected directly to the people and events and things that are going on in the system. I can also create a task for myself from here or log a call. So if I spoke to Maria and it was just I left a message or something, I could note that in the system as well. So I still have a few minutes. I've completed my review of Maria. I feel like I'm very, ready for that appointment. I still have a few minutes, so I'm going to go back, and I realized I'm also responsible for the after school program. And yesterday, we're going to jump ahead a little bit, and we're going to assume that the after school program is going on, and I need to take attendance for today. So you'll notice that showing up on my home screen as well, reminding me that I need to do that. And service sessions in NCCM, service schedules, allow you to, I'm not going to go through the wizard today, but would love to have the opportunity to show you in a follow-up conversation. But there's a wizard that allows you to say, what times and days does this class or this, perhaps it's a focus group, when does it meet? It's very similar to setting up a recurring calendar event in Outlook or Google. And then it will create a record for every session that you're meeting. So you'll notice here, if I wanted to put who led this session in here, I could do that. We could add fields here to say what curriculum items were covered, whether we did a craft, whatever information you'd want to capture about that meeting of our after school class today. And then you'll notice that that wizard would also add, prompt me to add people, create my roster for that class as well. My roster for this class is very small in my demo environment. You'll see that Carlos and Daniela are the only ones who are participating right now. It's going to allow me to set the hours. So we know that, for instance, that this class, after school typically lasts for 3 hours, but especially if this is a fee-for-service program, it may be important to note that, your hours, Carlos and Daniela, maybe mom picked him up early today, and we want to make sure we know that. There's other things that we could and have added here. For instance, if a snack was received, things like that. This additional information is customizable. I'm going to submit my attendance, and it will tell me that I've created 2 service delivery records, and it will have both let me know that they've attended, and then when I refresh my screen, you'll see that I've got service deliveries created for that, which will allow me to report on that later. It's also important to note that I can upload files here. So if I want to upload perhaps something that we had done that day in class, I can keep that right here as well. I'm done taking attendance, so jump ahead a few minutes and pretend that that Maria is here and we are ready to, I'm ready for my session with her. So what I'm going to do is go to that intake that I started, because I recalled when I was reviewing that there was some information that Maria didn't have with her that she needed to bring back for this in-person meeting. So a few things you'll notice about this intake, we've got our status right here. I should have marked this as in progress before. Or excuse me, awaiting client input, because we needed our information for her to bring that back. And as we review this intake, we'll see that this came from an inbound referral from Catholic Charities, Janice Green in particular at Catholic Charity. I've got my client information here. So this is brought right in from that contact record we looked at before. So if I enter it here, it's automatically, it's just saving it in that one place, but it's accessible wherever we need it. If I needed to collect a different additional information, or if programs had different intake details that they needed to collect, we could do that here. This particular one is a behavioral health focused, but this could vary depending upon the program in which the user is active, or the program for which we're doing the intake. The really important thing that NCCM adds here is this intake checklist. This is something that is configurable. This particular intake checklist is for my housing, for this particular program, for my employment program, but I could have different checklists, for instance, for my housing program, a shelter program, domestic violence, for the kids, for their after school. These checklists could all be different, and these are all fully in your program manager's control, and they're things that they can add through point and click. So we'll see that I've gotten most of the way through. I've collected all the personal information. I've done income verification. This is something that we at Provisio have built out as one of those extenders to NCCM to collect and capture intake information and calculate that AMI and FPL. That's really important for validation and eligibility. And so I know that I need to, the income information is here, but I need to upload those files. So I can upload files. I don't have files prepared, but I can upload files directly. I have a couple pictures here. I can upload a file. So this would be the pay stub. So I'd upload this directly to the intake. And that ROI, though, that's needed when we look back. So I'm going to check off that I collected the pay stubs, but we also needed her to upload, we need to upload a signed release of information. So I'm having Maria sign that. That's something I don't want to upload to this intake, because I want everyone to know if Maria comes in to get serviced by another program, I want everybody to know that that ROI is already on file and that we don't need to do that again. So that's something I can upload directly to her client record. So anyone looking at that client record would be able to see that. If I needed to have done an assessment as a part of this intake, that would be right here, and I could do that. And now that my intake is done, I've collected that information. I can change this to approved. I'm going to close that out as of today. I can put in some notes if I wanted to. And then I could also enroll her directly in my program. I've already created one, so I don't need to do that. And then again, as we saw before, I had created that outbound referral for her to refer her to the food pantry. So now that we've completed that order of business, we're gonna, I'm having a conversation with Maria and figuring out how it is I can help her. And in the process of that, I'm gonna create a client note. So we've got this great interface that NCCM provides, so we can see all the notes related to Maria. These are from her other engagement with rapid rehousing. And again, we would work with you on who's able to see those things. And one of the first things I'm going to do is select my record type. This is just a way of saying that we may want to differentiate the information that we're capturing between our employment program, for instance, and our housing program. We may want to collect different things. So our notes may be different. I'm going to say that this is my initial case meeting with Maria. I'm going to link this to her employment engagement. So again, that program engagement, if I didn't explain it well before, it's just a way of saying that a client or perhaps a volunteer or another organization is engaged with a program, a specific program area at your nonprofit for a defined length of time. So when we looked at that other one, we saw that it has a start date and an end date. And that's where we can record that outcome like we saw with the housing. We're going to say our interaction date is today. This is an in-person meeting, but we could have, Zoom, virtual meeting, phone call, whatever that may be. I could also create tags. So if, for instance, it's important for my organization to know if something was connected to COVID, like she has a job loss or is looking for a job because of that, I can tag that. So that would be available here in my notes, and I could filter by that. And then I can create my note. Okay, I can create my note. I have all fill text capabilities. So I could add a photo in here. I could have bullet points, numbered lists, bold things. For those case managers who, are very particular about the format of the notes, we can do that. The other thing that we're going to do as a part of this meeting, I'm going to do this in another tab. I'm going to go back to Maria. So as we're talking to her, I'm taking my notes, but then I'm going to create a case plan for Maria for this new program. We want to know what's important to her. So I am going to create a case plan, and it's going to walk me through. I can put a description here. It's automatically tied to Maria. And again, this wizard's going to walk me through some templates that my organization and my program director have already created that may be applicable to employment services. So this is just going to be employment services. This is only going to show me the programs with which Maria's been engaged. And you'll notice that there's several goals that are templated here that I can choose from. So I want her to create a resume, complete a mock interview, interviewing workshop. She already has a high school diploma, so obtaining a GED is not a priority. It doesn't need to be a goal for her. And then based on those action items, it's going to tell me that I have some, and based on those goals, there's some action items that I can complete. So we want her to do these things. And next, it's going to let me review. And I'm going to save this, and it's going to take me to that case plan. I'm now going to be able to see all of this. And once we start making progress, sorry, I thought I had closed that. Once we start making progress on those goals, I would be able to mark those off very easily. And we're going to be able to see the needle move. So really important. These are things that you could even surface in a Salesforce Experience Cloud. So we could use that to surface these to Maria so she could see her action steps and note when things had been completed herself. Could be really impactful for her. So going back to our notes, I'm going to now relate this to that case plan that I just created because I want to know that that's something that we completed today. So I'm going to relate that to that. And then I'm also going to say that log those services that I created. So I'm going to say we did some coaching today, 30 minutes of coaching, and we also did some job search activities, and we spent 30 minutes on that for a total of an hour. So I know that I'm racing through this really, really quickly, but I've now recorded my interaction with Maria today. I've recorded the fact, I've uploaded those important documents that we needed to capture for compliance reasons, and I've recorded our interaction. All of this accumulates in fantastic reporting. So when we look at our case management dashboard, all of the activity that I did as a case manager is going to be available to me, to my supervisors, and to my executive team. This dashboard actually comes delivered with NCCM. And what we've done is add a filter by program so that here I can see what's happening in all of my programs across the board. So that includes things like how many people do we have enrolled? How many people have been enrolled per month? How many referrals have we been making and receiving? Units delivered of service, things of that nature. Any of these can be popped out and downloaded to be included in a board report or an annual report. And I can even download my entire dashboard or subscribe to it so that it's going into my inbox or my executive director's inbox on a daily, weekly, or monthly basis. And as I said, I can filter this by program as well. In just a second, I can get from this report, this dashboard, into the underlying report, which provides full functionality of Salesforce drag and drop reporting engine, which is really powerful. And I can also get directly into that detailed information. So in just a couple clicks, I've drilled down from the dashboard that's showing me that high level right into something that may be an anomaly. So thank you so much for your time and attention. I know I went through this really quickly. I hope I've just whetted your appetite for the things that are possible with NCCM and case management for your human services organization. And I know that we'll have a few moments for questions, and then a member of our team will be reaching out to you to see if we have additional questions. If you have, additional questions, we can answer. So, Maddie, do we have any questions in the chat?
I am not seeing any questions come through so far. So if you do have any questions, please feel free to enter those into the chat. And Erica or Thomas will be free to answer them. And if you don't have any questions right now, but any come up in the future, just feel free to reach out and we would be happy to answer them as well.
Yep. So thank you everyone again for your time. And as the two ladies said, we will be following up with you very soon. So enjoy your day, and thank you again.
Thomas, we did have one question. We did have one question pop up.
Okay.
Is there an additional charge or included with the Salesforce package, and the charge is mostly build out related? Adriana, that's a great question. NCCM licenses are a particular license that you can purchase from your Salesforce account executive. So you can talk more with them about that, and we'd be happy to discuss that more as well. So it is again, a specific license that you can purchase. There is a charge for the build that can vary from a basic, what we call a quick start. So we can just configure those things that are a part of NCCM, or, obviously as the complexity grows, the number of programs and anything you'd need added on top of the NCCM functionality would be an additional implementation charge. But great question. Sorry, Thomas, you can wrap it up now.
No worries. No worries. So again, we really appreciate y'all checking in with us midweek. And like I said, we will be following up to do, if you would like, even a more personalized demonstration for your particular agency or org. So thank you very much, everyone. Enjoy the week and have a great day. Thank you, everyone.
Thank you all.